The whole point of this topic, and the reason why so many of you are here, is we're going to be talking about how to overcome chronic, persistent pain by using advanced technologies for more appropriate, more advanced healing. What's so exciting for me is because in the conservative method of medical field that I'm in, trying to avoid pills and surgery and injections. But what additional avenues do we have to help give us some relief that don't demand reliance on these other devices like surgery, pills, or injections that really only mask the issue without ever really solving the issue? And where I've seen in my field a great degree of improvement in conditions, but then often kind of this space where we only can get so far before we have to just accept where we're at. And my whole frustration with that approach was I still feel like there's more to get. There's more improvement that can be had. We just haven't been able to identify how to get it without feeling like we have to rely on pills, injections, and surgery. And so that's what triggered my pursuit of what additional technologies or devices have been developed or are out there that can offer that relief that we have access to. And that's what we're going to be talking all about today, to introduce to you a few things that are kind of new, cutting edge, but actually have been around for a long time, just more accessible in other places outside of the US. But a quick bio about me. Many of you are already familiar. My name's Dr. Nick from Preferred Physical Therapy. I've been around in this area now since 2015. I originally started practicing physical therapy out in the East Valley and then moved out here to take over my dad's clinic when he retired in 2015. Helped thousands of people with chronic pain overcome their situation, and ultimately what we all are striving to do is lead a good life, a healthy life, and one that we can enjoy, particularly in retirement when now we have the time and funds and resources to enjoy the body that we have with those who we want to enjoy it with. And that's ultimately what we're trying to do. The reason why I'm here, this is my family. It thrills me every time to talk about them. This is a recent photo that we had this past October in Newport Beach, where we go every year with family. My son Jackson on the right side, Jacob, so he's 17, Jacob is 15, Alex is 13. You can see that that is to scale. They are all taller than me. And my wife, Jessica, my oldest son is on his mission, and in this picture here on the far right, can you tell which one's mine? Any guesses? The enormous one that's standing over there. He's down in Mexico serving a 2-year church mission. He's been there almost a year. This June will be a year. And we stay very active. My son's obviously very involved in basketball and had the opportunity to play in the state championship. And they won, which was absolute thrill for us. First time in the school history and a lot of fun. So we stay very active. My family's very active. As I mentioned, my dad is a physical therapist. I'm a physical therapist. My older brother is a physical therapist. The sister just after me has a master's in kinesiology and owns a gym and a volleyball club. And then my younger sister, Dana, is actually our media specialist, kind of the one who's broken away from anything health and fitness, but now documents all of it so that we can help communicate it to an audience who is looking for solutions that we can provide. Well, some of the things I really want to talk about is an understanding about what chronic pain is and why it's so detrimental as we get older, because it is one of those things that many folks become accustomed to just accepting. As we get older, it's just a thing of aging that we're just going to have to get used to enduring is chronic pain, chronic joint pain. And one of the frustrating parts of that is a feeling that it's just the way it is. What we're trying to introduce to you that is, it's not something that you just have to accept, but that there are other options that are available to help overcome that. Because what we do notice is chronic pain gets in the way of enjoying all the things that we want to do. So many times I've had folks come to me for this window of temporary condition where they're having knee pain or joint pain, and they're looking to be able to go on this long-awaited European vacation where now they have to navigate cobblestone steps, a lot of stairs, in an environment that's not ADA compliant. So how do we help them navigate these situations given their current climate? And for me, it's an absolute thrill to help them get there, but then also a point of frustration where once that's done and they come back and then there's things start to come back and linger. So how do we help overcome that next level, but also get them on a path that's going to ultimately lead them to be free from those chronic pain situations? The other big concern is that it is at a risk, chronic pain is a risk for elevating premature death, elevating your incidence of premature death. Also, it's been correlated to accelerating or advancing cognitive decline. So early stage dementia, chronic pain is associated with accelerating cognitive decline or dementia. Why it's so important to take care of. The other thing that we recognize, chronic pain, even in our 30s and 40s, is a time to really get concerned with how is that going to look 5 and 10 years down the road? If we don't address simple pains or simple aches now, what is it going to look like 5 and 10 years down the road? For example, at 40, I can do a 10-mile hike, no problem. What does it look like at 50 and 60 if I do nothing and stay the same? What we all know is, as you might remember, what does your body and your capability look like 10 years ago? What were you able to do 10 years ago that now seems quite daunting or nearly impossible? The consequences of those things get higher as we age, so much so that even our, what we call activities of daily living, our getting up out of bed, showering, putting shoes on, putting pants on. How many folks have to lean into a counter or into their closet just to be able to raise their leg up and put their pants on? Those are things that we didn't have to do 5 and 10 years ago. But if we don't take care of some of these things now, what is that going to look like 5 and 10 years from now? Previously, it's been thought that the only way to manage these chronic pain situations is with medication, and often easy to do with over-the-counter meds, Tylenol, ibuprofen, etc. But now more and more, as we've been noticing in the news, there's more and more incidences of the risk or caution around opioid drug use, particularly in how addictive they are, but also how destructive they are, not only to the individual, but also the families who might suffer from those who are addicted to those medications. The other concern is the reality around what's known as polypharmacy. As we now live in a world with so many specialists, it's often seen where anytime you have a prescription for more than 5 doctors, you're at risk for polypharmacy, where the communication between those 5 doctors is no longer as good as we'd like it to be, to where we might have correlating prescriptions of medication that are counteracting or affecting the ability for another medication from another doctor to do its job. And so we worry about what happens then, and that often leads to chronic inflammation, cognitive decline, and even risk of falls. A clear understanding of what chronic pain is, different from acute pain. Chronic pain is any pain that lasts longer than 3 months. That's sooner than a lot of people think. 3 months doesn't seem like a long time because a lot of folks will think, oh, I've had this pain for years. I've had this pain for decades. Well, that's a chronic pain situation. Anytime we have a pain that lasts longer than 3 months, we're now in chronic pain. Again, different from acute pain, and we'll go over why biochemically that matters. The normal healing window happens within that 3 months. Once it is beyond that, and it's not as though it's like all of a sudden after 3 months, now we're in this chronic pain situation. There's definitely a spectrum that goes on. But what happens is now all the mechanisms and pathways of which that pain is dealt with now changes. Again, going back to common treatments for chronic pain is any degree of conservative care, massages, over-the-counter pills, physical therapy, chiropractic treatments, acupuncture, and then surgery and injections. The reason why many of these don't work is often missing treating the root cause, the underlying cause. And when chronic pain sets in, it's no longer just treating the diagnosis. That's what's so conflicting, is because we often think that if we just get the right diagnosis, we'll be able to then intervene with the right intervention, the right treatment. But now we're dealing with an accessory or an additional condition, which is chronic pain. Once we can even clear up and treat the underlying root cause, we still have this chronic pain inflammation that's going on, and that's what needs to be disrupted or treated. Chronic inflammation is the issue, different from acute inflammation. Acute inflammation is triggered anytime we have a sudden fall, or we have a sprained ankle, or we bump or a bruise. We have acute inflammation, and acute inflammation is a normal step in the healing process or in the healing phase. Nothing to be alarmed about, because that is a trigger. It's a cascade. We call it a biochemical cascade. It's one thing that then triggers a system or sequence of other mechanisms that occur in order for the body to recover. It's all normal. It's all well and good. It activates our immune system. It helps to fight off the infection or whatever acute injury is going on. And once that threat has been dealt with, the body then releases anti-inflammatory mechanisms that helps to clear and move the body past that stage. It kind of shuts off that signal, and we move past it so that the other pathways can clear. In a chronic pain or chronic inflammatory system, that does not shut off. It does not trigger that cessation or that conclusion of that pathway, and instead it continues and lingers, and we get this cyclical pathway of chronic pain, chronic inflammation, into spasm, into inflammation, and so, and which is why we get these things that linger for months, years, decades, and so on. This is that chronic inflammation description where it does not release that anti-inflammatory trigger to stop that inflammatory phase. We get stuck in that inflammatory phase, and that biochemical cascade continues, which triggers a cytokine release. It triggers more of these biochemical pathways that increase pain receptors. So there's more of them that exist that then our sense of pain, often fibromyalgia, where some of these conditions now exist because we're dealing with an environment where we are in chronic pain. So we have increased sensitivity and more pain. These additional triggers or external triggers can, and perhaps you've noticed, with poor sleep patterns, we get more inflammation, more pain. Diet, so more sugar, more caffeine, sometimes even red meats. Other dietary factors can trigger more inflammation. External stress, so working, a lot of family in town, other things that can similarly trigger chronic inflammation. The whole point and goal of regenerative therapy is to not only stop that chronic inflammation phase, but then also to then restore and regenerate healthy tissue. And that to me is what's so exciting. That's what's been missing so often, is we're now promoting and healing the tissue that's at risk of these things. Unlike procedures like injections and surgery, injections cover up, they mask. It's very similar to this, raising the carpet up, sweeping that dust under the rug, laying it back down, and hey, I don't see it anymore. It's still there, it's still the problem, or we're just not feeling it anymore. Surgery might blow your mind a little bit, but a lot of these surgeries that go on, the whole thing they're doing is they're treating the damage that's been done by the chronic pain. Now that might help with the pain, that might help with the condition, but it doesn't help what caused the need for surgery in the first place. Now, unlike a traumatic event, unlike I fall, break my arm, and I need surgery to repair my arm, that's different. Our chronic cases are degenerative disc disease, osteoarthritis disease, things that lead to total joint replacement, things that lead to herniated discs or lumbar fusions. These are chronic conditions that now require external interventions like surgery, but are actually caused by underlying issues, whether that's muscular imbalances, sometimes genetic, movement patterns, so the way that we move. Those things correlate to the rapid or more quickly breakdown of those environments, requiring that external intervention. Again, that's not really treating the issue. It's fixing the issue as far as the breakdown, but it's not treating the condition that led to that breakdown. The regenerative therapies give an opportunity to do that without as invasive a procedure as surgery or the damaging and potentially destructive interventions like injections. I mentioned the fact that these are non-invasive. They allow you for faster healing and also have been reported to be more effective in pain relief than injections and than opioid drug use. EMTT and radio shockwave are the two major devices that we're introducing today, and both are FDA approved. In the last 5 to 10 years have been FDA approved. They've been available in Europe for a lot longer. The first time I heard about it was in 2005 when Dwayne Wade, playing for the Miami Heat NBA basketball team, was having plantar fasciitis, and he was electing to go to Europe to have access to a shockwave device that was going to help cure his plantar fasciitis. That was before I was even in PE school. I'd never heard of these things, and it just seemed a bit more like voodoo, a bit more like what's going on over there, not really sure what's happening because we've never heard about it in the States. He went over there, had that done, and he was back playing within a week, which from a plantar fascia standpoint, anybody who's had it knows just a week in treatment, that sounds outrageous. I mean, it sounds a bit like phantom because you never see that kind of relief with plantar fascia. However, obviously with the amount of resources that NBA players have, a quick flight overseas to get treatment and then a quick flight back, no big deal. What's so exciting about us now is that it's been becoming much more widely available, much more heavily researched, and now we have the FDA label of approval. EMTT, so this is different. EMTT is extracorporeal magnetotransduction therapy. What I really like about it is it just hovers over top of your clothing or hovers over top of the area that we're treating. You hear loud clicking sounds, and you might feel like a static charge, kind of like when you're rubbing your feet on the carpet and you feel like it's a little bit of that buzz. Otherwise, you don't feel anything. And it doesn't need to be touching or contact with the skin. It's completely external. But what it does is, because of its frequency, it draws in an immense amount of blood flow to the area. And from where I get very excited about it is it improves the ability for the red blood cells to then infiltrate that damaged area of tissue. So red blood cells, just a quick reminder of what they do. Red blood cells are like the mules of the body. They're the ones responsible for carrying all the healing nutrients, your oxygen, your magnesium, your potassiums, your nitrogen, all the things that the body needs to heal and recover. They're the mules. They carry all that into the tissue. And what's unique about them is they have an actual physiologic width, like there's a size, we're talking microscopic. And the red blood cell, the blood vessel responsible for delivering that red blood cell to the tissue, to deliver the nutrients into the healing tissue, is called a capillary. So the functional width of a capillary is this exact size of the red blood cell. So you can imagine the 101 freeway merging down to one lane. How does that go at 5 o'clock in the afternoon? It's an extreme point of congestion. Now imagine it's under construction and we have to narrow all that down. It's a huge slowdown. So that's kind of what's going on with our body. Anytime we have injury, we have a whole bunch of cellular activity going on in that area, and it slows everything down. We already have a single lane track, a capillary, functionally the size of a single red blood cell to pass through. They line up in single file, and that's what's happening. How quickly can we facilitate the motility of those red blood cells through that skinny capillary into that demanding tissue of all those nutrients is what's going to help determine how quickly you can recover and repair. So EMTT is a way that does that. Now, what's also unique is it helps to break up the cell membrane of the body. So cells have a membrane that helps to protect it and secure it, kind of give it a little bit of physical property. The more permeable, the lighter that filter is, the more those nutrients can get in to help repair the cell. The EMTT device also helps to expand that membrane, make it more permeable, more easier for those nutrients to penetrate and then heal the cell. I'll go over a few other devices that actually help improve more cellular function, but that's how the magnetotransduction device works. Really effective in helping reduce pain and inflammation. Helps to reboot the cell, so you get nitric oxide release. Again, it's a healing factor, healing, it's kind of that biochemical cascade that occurs that then helps the cell to repair. You get secretion of growth factors. This is all a cascading effect of what goes on in the healing process and how the EMTT device helps to kind of shock the cell, improve its cellular membrane, the permeability of that membrane, and then allow these factors to then enter in and repair. Cytokines are the inflammatory cells. It helps to reduce and dissipate the cytokines, and then stem cell activation. Stem cells also getting a lot of publicity because we're now utilizing stem cells as a way to bring in the chance for new tissue to be grown. Stem cells are like, the best way to describe that is a fresh bed of tissue that the minute you introduce it into another tissue, it then forms into that tissue. What makes it so unique is it's a neutral cell that as it's introduced into a new area, it'll proliferate into that tissue. So it becomes very exciting when we talk about cartilage, where it doesn't heal well on its own. A very, very poor healer. But we can introduce stem cells into that area with the possibility that it will differentiate and produce new cartilage-like cells, a new cartilage-like tissue. It's not perfect, but we're seeing some benefit to that. So our body has natural stem cells. Natural stem cell production, and EMTT is a way that helps to activate and release some of those stem cells into that area so that it can do that. And whatever tissue is damaged or at risk is the one that it'll differentiate into. Again, kind of going over the application, quick photo. It's that circular wand. It dissipates a magnetic pulse on both ends of it into kind of this mushroom-shaped cylinder that then circulates kind of over top and through. It gets down to about 18 centimeters of depth or 7 inches. The way that we dose these things is twice a week for a minimum of 4 weeks, so 10 sessions from an intense dose. That's kind of the minimum dose. Depending on how long you've had or how chronic a case is, how flared up the case is, you can require more, but that's the minimum dose that we tend to say, okay, if this has been beneficial, if we're seeing a difference or improvement, then it would be beneficial to continue at another level or another dose. The good news is it's very quick. Anywhere from 8 to 15 minutes. It's 8,000 pulses. For folks who have had it, I know several of you have, you hear just a clicking sound, and every click is a pulse, and you'll get about 8,000 of those. Sometimes we'll move the wand. We'll have about 2,000 pulses in one area. We'll move it into another area just to kind of help improve how much of that tissue is getting exposed to that magnetic pulse. Again, we can treat larger areas up to 30 centimeters. Great for any kind of extremity, even the spine, low back, neck, shoulders, elbows, wrists, knees, hips, ankles, plantar fascia, calf, any kind of muscle strain, high hip, glute, hamstring, those kind of issues. Again, you can typically see a benefit within 3 to 4 sessions. Many folks who have acute pain will see it within session, and anywhere from 8 to 12 weeks are when we typically see the maximum benefit, because that's how long it takes for tissue to actually heal. There's a time component to healing. Many folks who've had an acute injury in the past, you noticed it just goes away on its own. Many times it will. Now we notice as we get older, those incidences are fewer and far between. Now it takes a bit longer for those things to get better. Sometimes not at all until we require some additional intervention. Not like the old days when, high school kids roll an ankle and it's like, okay, a week later, I'm feeling pretty good. When you roll an ankle, it's like, okay, give me a couple of months to recover from that thing. What we're trying to do is harness the ability. The reason why they heal so quickly is the amount of blood flow. They have so many more capillaries, so many more live tissue that is getting so much blood flow to repair and improve. The benefits of EMTT, evidence-based, meaning that we have a list of research that's been peer-reviewed and studied, meaning that it's been reproducible. So it's not just that the one device or this one study group has been able to produce these results, but multiple study groups who have researched the same protocol, the same intervention, is also getting the same result. That's what we get so excited about anything that's been evidence-based. It is not invasive, it's external. You don't burn any other kind of bridges by using this device. It's very easy to do in addition to other ones. No side effects, no removing of clothing, lots of applications for advanced and improved healing. The conditions that receive the greatest amount of improvement, all your arthritis cases, rheumatoid arthritis, herniated discs in the low back, thoracic spine and cervical disc, spinal stenosis, so it's a narrowing of the spine. Anytime we have inflammatory processes around the spine, we get very good results. All your DJD or DDD, these are things that you'll see on an MRI or X-ray, degenerative disc disease or degenerative joint disease. So if you have any of those diagnoses, you're a good candidate for EMTT. Radiculopathy is any kind of traveling nerve pain. Nerve pain down the arm, nerve pain in the legs, you're a good candidate for this. Again, carpal tunnel, similar kind of nerve pain into the hand. Any bursitis, inflammation of bursa sacs around joints. Most commonly you see it in the hip, we see it in the shoulder, we see it in the elbow, and a bit in the foot and ankle. Any tendonitis, Itis means inflammation. Tendon is what connects muscle to bone. So it's that piece of tissue in between where the muscle contracts and shortens and where it anchors on the bone to actually get a lever to move. Chronically or historically, tendons are poor healers, not a lot of blood flow there. They are contractile, they do move and stretch, and so they do respond really well to load. When we do an intervention, like a physical therapy intervention, we do a lot of things to load them carefully, but they're slow healers. They're not a lot of blood flow. That's why we really like using Shockwave especially, but EMTT is a really good supplement to any kind of tendinitis, tendinopathy, tendinosis, all things to describe some level of decay to the tendon. Diabetic foot conditions or polyneuropathy conditions, anytime we have reduced blood flow to extremities, particularly the feet, that lead to nerve death or nerve decay, extremely effective in treating those conditions. Fractures, so bone healing, it's really helpful with bone healing. Post and pre-surgical conditions, joint replacements. A lot of folks freak out at the fact that it's a magnet and now I have metal in my knee. Are you sure we can do that? Absolutely, I'm sure. It's totally safe. We do it often. We've had folks who've had knee replacements 5 years ago. They come in and they have enormous relief, are just thrilled with the fact that while the knee replacement did help to a degree, they're still having some of this pain and they have no concern with using this magnet around their metal components because it does offer a great deal of relief. Phenomenal with chronic pain. Even better with acute pain. Acute pain, acute soreness, muscle pain, muscle soreness, phenomenal at getting very, very quick relief. Those who aren't good candidates for the use of EMTT or anybody who has an embedded or internal electronic device, so your pacemakers, your ICDs, deep bone stimulators, deep brain stimulators, spinal stimulators, a diabetic insulin pump that can't be removed, a cochlear implant, any of those electronic devices, we try, and even if you're wearing an Apple Watch, we have you remove it, keep your phone away, give it about 3 feet away from the device is the concern. So those are folks who don't do well. So now we're going to move on to Shockwave. Shockwave is extracorporeal shockwave therapy. Very fancy name, we just call it Shockwave, so just call it Shockwave. Extracorporeal just means outside the body. So a Shockwave device is different because it uses mechanotransduction versus magnetotransduction. Mechanotransduction means there's a mechanical intervention to the tissue. It's an external device that provides a mechanical introduction or intervention to the tissue. It uses high energy acoustic waves, so there is actual touching or pressure of the skin to the device, and then it transmits acoustic but also mechanical waves into the tissue. And then therapy, it initiates healing process. Kind of how we break down that word to introduce what it means is anytime that we use some device to improve healing. The way that it works is, as it's an external device, I like to call it an external meat tenderizer. So it's a muscle tenderizer because you will feel it. You will feel the impulses from the device. They are quite rapid, different from those handheld percussive muscle massages, very different from those. We use ultrasound gel to facilitate the movement of the sound waves from the device into the tissue that then help to trigger the recruitment of stem cells, the release of growth factors. Again, it's a biochemical cascade that then improve and facilitate healing. What's so unique about Shockwave is it increases blood flow to the area, much like I've talked about before, where we get more improved motility of red blood cells, mules of the body that deliver the nutrients into the tissue that's healing. We facilitate that, we improve that, but what's also unique is after 10 weeks of using Shockwave at a minimum of 3, the research has shown that a minimum of 3 is the one that's been statistically significant in producing the difference, or the fact that they've been able to measure there's an improvement in the condition because of this intervention. The minimum is 3. At 10 weeks, we get what's called an angiogenic effect. Angio meaning blood vessel, genic is genesis or creation of new blood vessels. So it provides an angiogenic, or it improves or increases new blood cell production. So in an area that was otherwise poorly vascular, not getting enough blood flow, the use of Shockwave increases how many blood vessels we have in the area to deliver red blood cells that then improve healing. That's what to me is so exciting, because now we have areas that otherwise are poorly vascular, not healing well or quickly, and we can improve how many red blood cells are able to access that area because we're now creating more roads to that area. There's more lanes of traffic that can get there in order to heal that area. So applications similar to ultrasound, if you've ever had that, we use ultrasound gel. We have an external, kind of a handheld wand that we do use right to the skin area. 10 to 15 minutes, or about 4,500 to 6,000 pulses. With this, we do one treatment every 5 to 7 days, or about once a week, but one treatment every 5 to 7 days in the same area. We can do multiple areas, multiple times in a week, but in the same area or singular condition, we do one every 5 to 7 days. The area that we typically treat is about the size of a dollar bill or cell phone. We try and keep it somewhat condensed or concentrated to the area, and it can go anywhere from 2 to 5 centimeters in depth. Virtually no side effects or risks. You might get a little bit of soreness, a little bit of bruising to the area if you bruise easy. We ask that you stay hydrated over the next few days, similar to like a massage. We want you to stay hydrated. Also, it is providing, what's also unique about Shockwave is it is providing an acute inflammatory event. Meaning, like I mentioned earlier, inflammation is not a bad thing. Inflammation is a good thing. It is a step to healing. It's a bad thing when we get into this chronic cycle and we can't break it up. What we like to do, or rather what's the benefit of using Shockwave, is it introduces an acute inflammatory event that allows that kind of jumpstart that inflammatory cycle, that release that biochemical cascade, that then it ends that inflammatory event. So we don't want you to use any anti-inflammatory measure like over-the-counter pills that have an anti-inflammatory effect like ibuprofen or naproxen or Motrin, nor do we want you using ice or other things that historically lower inflammation. We want you to experience the inflammatory event. Typically you'll see, as I mentioned, a minimum of 3 treatments is necessary. You typically will see results right away, though not always, but you typically will see it right away. And it typically takes 4 to 6 weeks to actually fulfill a typical treatment dose. 82%, this is what's so alarming, 82% of folks who have this done over an area where it's indicated like plantar fasciitis is the one that's been most researched, 82% get full resolution of their pain. 82% with Shockwave for plantar fasciitis. It's alarming to me because for me it's historically been one of the hardest ones to treat and get better because every step we have pain. It's hard to mitigate the load across that issue. But with Shockwave we're able to do that because we improve the elasticity to the plantar fascia. We introduce an ability for that tissue to experience and accept load without causing an inflammatory event. And that's what we like so much about it. Typically, the maximum benefit is noted at 12 weeks of treatment, and that's because of the angiogenic effect. The fact that we're getting more blood vessels to the area of problem. The biggest benefits, the Shockwave, non-invasive. So we're not getting into the tissue to damage it at all. There's no anesthesia, there's no risk of infections, there's no scarring, there's no downtime. It's not as though that we do this, now you can't go for a walk, or we do this and you can't go to the gym, or you can't go to something. It's not that at all. You can do whatever, it's not a problem at all. Over an 80% satisfaction rate for faster and more productive, more advanced healing. Again, one of the most advanced and highly effective non-invasive treatments that's been cleared by the FDA. Cleared by the FDA, non-invasive and most effective. The ultimate way to treat soft tissue conditions, more effective than stem cell injections and PRP. Anyone here had a PRP injection, protein-rich plasma injection? Very effective, and been now kind of narrowing down where they're finding the most result with PRP, typically after a surgery, after an inflammatory event where there's an opportunity for that healing factors of that protein-rich plasma to have a chance to heal, but not so great at chronic cases. And this has been really great with chronic cases and cutting healing time down in half. Kind of mentioned with Dwayne Wade back in the early 2000s, getting back to playing competitive basketball within a week. Things that it treats, name a joint, and yes. Other than TMJ, maybe not so much there, but all the others, even up here in the cervical spine, we have a new tip or end of the device that's silicone that is a lot softer and gentler in bony or more sensitive areas. We've been loving it for, particularly up here in the neck, bony, like right where the tendon inserts into the bone. Been really effective across the knee, a heel or Achilles area, other places. Sometimes you get really tender across here, and if the typical parameters for dosing is too much, then we can introduce a silicone tip and it's a lot more comfortable and still get some result with it. So any kind of trigger point pain, any neuropathic pain, there are protocols to improve neuropathies for the feet, which otherwise typically have been very difficult to treat. Tendonitis, acute tendonitis, plantar fasciitis, all your itises, this is any tendon-related pain. The Shockwave device is my absolute go-to because one of the things with tendons that become irritated is as they are introduced to inflammation and to swelling, they become rigid. The thing that tendons cannot do is get rigid. When they get rigid, what happens to them? They break. Tendons, when they break, all kinds of problems with that where now we have to reattach that tendon. So the more we can keep that tendon elastic and compliant to load, allow it to accept or receive that load safely, the better. And that's why anyone who's had plantar fasciitis and the first few steps out of bed or the first few steps after sitting for a period of time are the worst is because that tendon is not elastic, the tendon is not stretched, it hasn't had a chance to warm up and become kind of comfortable to receive that load. And then as it gets going, it feels a little bit better. That's the warm-up effect. Shockwave has the ability to keep that tendon very elastic and very comfortable. So who is it not for? It's not for people who are actively pregnant, any kind of tumor or infection, and we try and not do it if you've had a corticosteroid injection within the last 6 weeks. We wait, because systemically we want to give that tissue as much time for that corticosteroid to kind of be absorbed or removed from the body, and then we can introduce an inflammatory event with Shockwave to then get healthy inflammation into the system. What we really are excited about is the combination. Utilizing the combination of treatments. We can do EMTT twice a week and Shockwave once a week. EMTT helps to kind of recharge and re-energize the cell, and then the Shockwave helps to come in and really allow that recharged cell to get as much of the nutrients into it, and then the angiogenic effect to take place. The combination of the two has really been shown to be the superpower of both those devices. It speeds healing processes by up to 20% when used together. EMTT allows the cell to kind of have a reset or clean slate, and then the Shockwave helps trigger that healing process to go on. A few case studies that we've had with patients: a 77-year-old female, chronic plantar fasciitis over a year. Perhaps some of you have been in that same situation, or know friends who have this inflammation in the foot, pain in the foot that's not been going away, heel pain. A lot of folks will call it heel pain. They've gone to the podiatrist, done the corticosteroid injections, getting some levels of improvement, some levels of pain reductions, but it keeps coming back. The pain was listed at a 4, at its easier time, up to an 8 out of 10 at its worst time when they're walking. They did Shockwave once a week for 3 weeks, and now their pain is down to just below a 1 out of 10 versus the 4 to 8 out of 10. She's walking better. The first few steps out of bed, no longer a problem. That's when she gets her high spots of pain, up to a 1 to 2 out of 10 pain, but with much more minimal discomfort. Now, there was a 39-year-old male with herniated disc in his neck. C5, C6 is the most common herniated disc in the neck. All kinds of pain and tension across the upper traps, a little bit into the arm, but a lot down in the back of the shoulder blade area. Had the steroid injections, did trigger point dry needling to try and help loosen up some of those tight muscles that are contributing to that passive tension and passive load that's contributing to the herniated disc pain. Did traction, did cupping, did doses of high anti-inflammatories, and the doctor is now recommending surgery. All the conservative treatments had failed, and that's when you know it's time for surgery. And what they do for surgery for herniated discs is they either go in for a microdiscectomy where they shave down that herniation, or they go in and they fuse it. So there's no more mobility of that disc to cause irritation on the nerve. That's what you're facing. At 39, it's a very common time, actually between 35 and 55, particularly with males, but females will have it too, is they'll get that herniated disc in the neck and often causing pain, burning between the shoulder blades, and many will resort to either injections or surgery. But thankfully, this worked really well. So we did EMTT, the right side, twice a week for a month, as well as Shockwave to the right kind of neck and trap area, as well as a bit into the chest, but also along the cervical paraspinals, chest kind of down into this pec minor area. And now he has zero pain in his arm, zero pain in his neck, no more pain meds, no more having what we call radicular pain or symptoms down his arm, feeling significantly better. And now, while we're totally thrilled with this, we're also aware of the fact that this might come back. The biggest predictor of future pain or future injury is previous injury. The great news about it is the fact that he didn't do surgery to fix this, which also will result in future pain. Many folks who have had back surgery recognize the fact that while some of their pain is better, the reality that they're going to have pain in the future is extremely high. It's not as though it goes away. In fact, there's a new medical code, a new medical diagnosis that's called failed back surgery syndrome. It's the reality that even though they've had a back surgery, there's no more intervention that can be done, they still have back pain. It's one of those realities that exists. What's so exciting about this is that now we're able to treat and manage those kind of situations without the severity of intervention or invasion as surgery. I made a mistake here, obviously. The right knee pain, 74-year-old female with knee pain, history of meniscus tear. Meniscus tear is very, very common. Historically, we'd go in and surgically either remove or shave away that tear in the meniscus and think, all right, all done, all good, only to realize 2 years later they're no better than those who didn't have surgery. Meniscus tears are very, very common and very much similar to any kind of cartilage tear or fray, often what lead to total knee replacement 5 to 10 years later on. The recommended surgery was to go in and clean it out, also called a debridement. So to go in arthroscopically, just a few instruments, just kind of shave down, clean it up, try and get it all smooth, and then take the instruments out, sew it all up, all good. However, what happened is instead we tried to do a dose of Shockwave. And EMTT and Shockwave combination for, again, a month. We did 4 weeks of EMTT and then 4 Shockwave treatments over that same area. Pain significantly reduced, down to 1 to 2 out of 10 pain. Only with stairs, was able to move her knee more comfortably as far as getting up out of bed. The first few steps out of bed with her knee was extremely painful. Now not. And able to walk and move without and able to avoid surgery. And this is the knee pains. 9 out of 10 pain, 6 out of 10 pain at the worst, and foot pain increased or reduced from 6 out of 10 to a 2 out of 10. I was able to walk a mile without pain, and one of the most exciting things about this case was people think walking a mile is not a big deal or, great, but what was so important to her is this mile was a time that she would get together with her friends. So she had a walking group just over here at Westbrook Village, and it was her social time. She loved it because it was her time that she would talk with her girlfriends and be very social. This was getting in the way of that, where she wasn't able to keep up. And she was noticing she started to limp and didn't like having to feel like the group was having to slow down for her. So it was extremely important that she was able to do that, which is why she wanted to get this treatment so that she can be able to walk the pace that she was able to do with her friends and not feel like she couldn't keep up and everyone's kind of waiting for her. That social anxiety of being the odd one out or the one slowing down the group, and she was able to get over that. The other thing that we're introducing with red light, I am thrilled with red light. I've had 3 patients now just buy their own unit and have it at home, and I've helped 2 of them set it up. It's been great because they hire my 17-year-old to help set it up, and he's been loving it. He said, "Dad, this is great." They overpay, they dramatically overpay. His skills are requiring, but hey, it's fantastic. What I love about red light, it's photobiomodulation. This is on the quiz later on, so make sure you write that down. Photobiomodulation, okay? Or low-level laser therapy. So low-level different from cold laser or class 4 laser. What is so great about it is the fact that red light is a wavelength of light. It's a way to measure the wavelength of light that's being introduced into the skin and can get as deep as bone. Surprising to think that light can penetrate that deeply, but it's no similar than if you put a flashlight or turn a flashlight on, cover your hand, are you still able to see that light behind your hand? You are, because there's permeability. The tissue has the ability to receive light but also pass through it. And so it's no different. Red light is able to get that deep. What we get so excited about red light is it triggers and is absorbed into the mitochondria of the cell. Again, on the quiz later on, but if you remember back to 3rd grade biology, mitochondria is called the powerhouse of the cell. It's the one responsible for producing ATP, or the smallest functional unit of energy. We go back to how does our body function? It's a series of ATP production, which is fuel for the body, that then triggers the cell to perform its function, which then triggers the tissue or the organ to perform its function, which then allows the body to then move and perform its function. So there's the cascade effect. So we narrow down to the singular unit of ATP production, allows the cell to repair, to replenish. Cells perform its function, they die, and then they need to be replenished. We see that with our skin. Our skin cells will die out, they slough off, and then the next layer comes forward. It's no different throughout our body. The mitochondria of the cell is what is responsible for that. So the more that we can turbocharge that or amp that up, the more you'll feel the difference. So we can do, from a wellness standpoint, we do total body. From a more focused standpoint, we can do it over just a knee or a limb or a condition. Fantastic for post-surgical. Very good for skin healing, surgical scars, even chronic scars, acne, wrinkles even. It's really helpful in helping to improve skin health. Also circadian rhythm or sleep health. 40% of light absorption occurs through our eyes, through our retina, and that's actually what is triggered into our endocrine system. Endocrine system is like hormone release. So whenever you hear about endocrine system, think about hormones, hormone regulation. So light, and red light in particular, is able to influence that endocrine system or mechanism that then helps to improve sleep health, sleep quality, sleep depth, which obviously helps to promote healing. People who don't benefit from red light or that should avoid red light, anyone who's photosensitive, so your epileptic type folks, active skin cancer, some skin conditions like bacterial or fungal skin infections, open wounds, cuts or burns, that's kind of we actually promote the use of red light over open, like surgical wounds, even lesions on the skin. That can help actually promote or heal that. It's just a precaution. Ones that we don't like though are bacterial or fungal infections. We don't want to be careful about those. Pregnant women, we haven't tested it. We don't really want to either. We're beyond those stages, so we don't really know how it's going to respond, but we do recommend for pregnant women to be very much take caution. If you have any medication that increases your sensitivity to light, also are those who would be conditioned, sensitive to that, or any eye conditions. We have goggles that people can put on if they'd like to. Again, 40% of light is absorbed through our eyes, so I do recommend that you just turn your head. Don't look right at the diodes, but you just turn your head. Allow some of that light to be absorbed in. If you want to, for me, it's just a 20-minute nap. I put those goggles on, and we just disappear for a few minutes. Again, kind of how red light works, it's all about skin exposure. We do want to have as much skin exposure to the red light as possible. Helps to produce ATP, or adenosine triphosphate. That's how our body stores and uses energy. Increases cellular functions and efficiencies. That's the other thing that we often forget. As you notice, body doesn't heal like it did in our 20s and 30s. Our body at its 40s, 50s, and 60s, 70s for some of us, doesn't heal the same way. What red light allows us to do is it helps to kind of hijack and go back to how our body is able to utilize efficient, normal cellular functions like it did 5, 10, 15 years ago to today. And so that's what's so beneficial about red light. Improving skin appearance, your wrinkles, scars, redness, acne, those kind of things. It helps to promote any kind of muscle soreness, so post-workout soreness. It helps to improve the ability for that to clear up and go away. Non-invasive, natural treatment, very few side effects. I've only had 2 people out of the hundreds that we've had use it now report feeling a little nauseous. That's the case we have the ability to lower the intensity of red light. Typically we just have it up all the way. It's very safe, but 2 folks who have had nausea, one responded to when we lowered it down about 50%, and the other one still didn't quite, they still felt queasy, totally fine, not appropriate for them. But we've only had 2 out of the couple hundred now that we've had go through it report some level of nausea to it. Dizziness as well was with it too. Great for pain relief, faster healing, reduces inflammation, improves blood flow, circulation. We've had a lot of talk about the importance of circulation. Exercise improves circulation, activity, hydration, nutrition, all these things help improve circulation. These are devices now that are able to target and externally influence our body's ability to circulate blood, oxygen-rich, nutrient-rich blood cells into healing tissue. Non-invasive, and what we like, it's a complementary therapy to a lot of others. It's not as though we can't use that and this, we can use it in conjunction with the others. And the one that we'd really like to use it in conjunction with is PEMF, or Pulsed Electromagnetic Field Therapies. Anyone here heard of PEMF before? It's getting a lot more publicity, it's getting a lot more, now that I'm saying it, anyone on Facebook, you're probably going to be getting ads on PEMF devices now. What you're going to really like to hear about it is it's been more researched because, have you heard of grounding or earthing? Anyone hear about those terms? So the earth emits an electromagnetic pulse. So grounding or earthing, as we've noticed now, we live in a concrete jungle. Our direct connection to soil, to ground, to earth, is limited. There's a barrier now. So our body kind of regulates, I would say, is influenced by the regulation of the Earth's already emitting electromagnetic field. So you hear people in Japan call it tree bathing, as they'll walk in nature amongst trees. Why Central Park in New York is so important. Amongst that urban jungle, it's so important to have exposure to plants themselves. There's also a lot of studies that show just all the cytokines, the cellular activity that exists from the existence of plants and trees in proximity to our skin. There's an absorption of that life that goes on that is genuine, that is studied, it is researched, and beneficial to overall health, similar to the Earth's already emitting electromagnetic field. Pulsed electromagnetic field is a turbocharged experience of that. And so it allows a total body and more direct connection to the similar level of frequency, but at a higher rate of that frequency for our body to experience that same benefit. So what does that do? It helps to charge and improve cellular motility. Again, going back to EMTT, EMTT is 40 times more powerful than the PEMF device from a wellness perspective, but from a total body perspective, the EMTT, or the Pulsed Electromagnetic Field EMF device that we use in combination with red light, is able to fast charge the movement, the motility of those red blood cells that are nutrient dense into the healing tissue. And I say healing tissue because chronic inflammation, normal cellular processes that are working to kind of repair or overcome the cells that are already dying or already decaying, that's already normally happening, the faster our body is able to do that, the more efficient our body is able to do that, the healthier and better we feel. You've noticed you've had a good night's rest or you've been eating good for a while. How do you feel? You can notice feeling different, feeling better. So the use of these devices similarly helps to hijack the body's ability to feel better and noticeably different or better. It helps to organize the structure of our skin, the rhythm and melody of that already existing electromagnetic field in our body so that the cells can repair, can move, can replenish, and then pass through more healthy and more efficiently. Again, it helps with organs, blood flow, everything that our body needs to function. I already kind of talked about that, so recharging cells, enhancing the cellular performance and recovery, just fundamentally knowing it's an improvement in circulation and the ability for the cellular membrane to become more permeable or kind of less filtered so that more of those nutrients can be delivered, can be cycled through and moved on. People who would not benefit from PEMF, again, pregnant women only because we just haven't been able to study what that does to pregnancy. So those in middle term or late term pregnancies, not appropriate. Active cancers, epileptics, implanted medical devices, again, anything that's mechanical, as mentioned before, pacemakers. We still have used the MAT. There's a few different devices. We just don't like using a PEMF that's targeted over the area of the device. So kind of a concern. Any bleeding disorders, if you're on heavy, and I say heavy blood thinners, sometimes a concern because it is enhancing its ability to move. Children, just not as much safety data has been collected on its use on children. I've had my kids on it. My 13-year-old's been on it. He loves it. I'd bring it home. He would ask me every night to bring it home because he'd go to the gym or work out. He just loves the way it felt, and any photosensitive folks. So from a regenerative package, these are some of the prices that we use. From a Shockwave only to an EMTT only, are most kind of what we've been looking to do with singular conditions, knee pain, neck pain, any kind of singular condition. We highly recommend a combination package of Shockwave and EMTT, twice a week EMTT, once a week Shockwave for 4 weeks. And so it's 12 total sessions, 8 EMTT, 4 Shockwave. There's a kind of build that we're doing from a package standpoint. Folks who are like, let me just see how it goes, absolutely do one at a time. Once you feel like, okay, I'm ready to commit to that thing, then we can just do whatever money you've already paid. We just roll it into whatever package or bundle that you want to go with. In any bundle or package that you go with, we include access to our red light and EMTT. Devices that are otherwise fairly easy to get onto, that don't take a lot of intervention from us, but it's very easy for you to get onto. And so that's kind of what we're introducing from a standpoint of what access do you guys have to it. That's how we do it. A lot of folks who are here for physical therapy currently are able to just subscribe to a membership level that grants them access to red light and PEMF, and then they can purchase one-off treatments from EMTT and Shockwave, though we still highly, highly recommend the bundle because it is the dosing parameter that's been most researched and most proven to be beneficial to different conditions. One of the benefits of being here today, and thank you for being here, is the fact that we're going to grant you all the opportunity to do an EMTT or a Shockwave session for free. So what we'll have you do is just book that with Jennifer or Alani before you go. You don't have to necessarily do it today, but you can do it another time. But just call in. We have you registered. We know you've been here. But the thing is that you'll have access to do one of those treatments for free to say, okay, is that what I like? Did I feel a benefit? Did I, was the Shockwave enough or okay for me? Did I like it? Before you have to worry about making a purchasing decision. The biggest thing for me is I want you feeling very, very comfortable, not only with the access you have to these devices, but the fact that it's going to be beneficial for you. Ultimately, you're the one responsible for your recovery, and we want to be helpful or a tool in your journey to better health so that you can enjoy the most out of this already very delicate but also exciting time in your life as you enjoy retirement and what that looks like for you enjoying activities with loved ones, with family, and with kids. I know some folks are going to California here very soon, just got back from Texas, going to Europe, so folks who are looking to enjoy that, we want to make sure that you're very comfortable with what you're going to do next.